emotional and physical stresses that women are experiencing, and if you've ever seen a delivery, these emotional and physical stresses can reach heights which can never be imagined before. They get up there. Activates mom's hypothalamus, which signals for oxytocin release in mom's posterior pituitary gland. Once the hypothalamus is involved, a positive feedback mechanism is propelled into action. Greater contraction causes the release of more oxytocin, which causes greater contraction, which causes more oxytocin. Naturally happening here. So let's go through the events on this diagram. And this is the most graphic picture I've got in my entire thing. And my wife she covered this up. Anyway, with that little black thing. Here's the uterus. And here's baby, hopefully head down, just like it should happen. What's on the outside of this uterus? Oxytocin receptors, right? They're on the outside of the uterus. Why did they grow? Because baby's adrenal glands produced in mom's system estrogen, high levels of estrogen, which cause the oxytocin receptors to grow on there. Now as the baby got towards term, baby's pituitary gland, which is up here in baby's brain, causes the formation of oxytocin, which travels through baby's body, goes through baby's umbilical cord, through the placenta, into mom's circulation, which causes this uterus to squeeze, push, squeeze, and push. And it begins to squeeze, and it pushes down on the cervix and on the top of the vaginal vault, right up here. Well, lo and behold, there's pressure receptors. Pressure receptors down there in the cervix. They sense when something's smashing on it. It's a receptor there. And they send an electrical signal up to mom's hypothalamus. And then it releases a hormone to the posterior pituitary gland, which is up in mom's brain up here, which then releases her own contribution of oxytocin, which goes into her circulatory system and travels by way of the bloodstream, which the blood circulates around the uterus, and it causes the uterus to do what? Squeeze more. And it squeezes more. And what happens to the pressure receptors down there at the cervix? They feel more pressure. And it causes the system to crank up. Causes it to crank up. And every time it squeezes, causes more. And it's a positive feedback mechanism which culminates in this, everybody in the room saying, push, 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 push. If you've all heard it, and pretty soon, push, 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 and out comes the baby. And it's this positive feedback mechanism which starts through the cooperative efforts of both baby and mom. But of course, in order for this to happen, you have to have an intact pressure receptor. You have to have an intact nervous system. You have to have an intact central nervous system, a hypothalamus, a pituitary gland, and a circulatory system. All of those have to be intact, or it's not going to work. Placental hormones mediate crucial changes in mother's birth canal, allowing for safe delivery. Ooh, this is kind of important. Placental production of the hormone relaxin. Relaxin causes pelvic ligaments and the pubic symphysis to relax. What that's saying is this. Your pelvic bone is actually made up of a combination of bones. In the bone right there in the middle, there's two bones. It's held together by a ligament called the pelvic symphysis. And this hormone, produced by what? The placenta, causes that ligament to relax and gives it the ability to stretch. Stretch. Not only does it cause that to be able to stretch, it causes skin to be able to stretch. Stretch to things that you would never imagine on that. And it causes all of that to stretch. And that's why it's got the interesting name, relaxin. Causes it to relax on there. It says it causes the pelvic ligaments of the symphysis to relax, widen, and become more flexible. Most women appreciate that. This increased motility eases birth passage, but it may result in a waddling gait in the interim. So that's why women walk like they do when they're pregnant. Unk, because the ligaments are not stable, and that's why they kind of like do that. And that explains why they look like they do on there. However, of course, this raises a very interesting evolutionary question. How would you ever deliver a baby through that tiny little opening if you didn't have hormones like this allowing these ligaments to stretch and widen and everything else? And of course, you have to remember, these hormones are not being made by mom. They're being made by the placenta, the products of conception. Wonder what evolutionary explanation there is for that. During pregnancy, estrogen and progesterone, together with prolactin, lactation, milk production, prolactin, and cortisol act on maternal mammary tissues to induce optimal morphological and biochemical maturation. All right. Put in other terms, these are working on mom's breasts to make them bigger. All right? Simple as that. That's optimal morphological maturation on that. Interestingly, pre-pregnancy breast size and volume of milk production do not correlate. And I only left that in because everybody has a question on that. So it answers it. Thereafter, newborn suckling induces episodic oxytocin secretion in the maternal pituitary gland, and oxytocin acts on the myoepithelial cells, the little muscle cells around the mammary glands in her breast, little muscle cells which cause them to squeeze out the milk on the breast ducts to cause milk letdown. Clearly, the fetus infant acts to ensure its own survival. Now, isn't that interesting? Taking over mom's body, causing it to change, causing her to waddle, even causing her breasts to get bigger, and now causing them to have the right capacity in order for the milk to be let down on that. And it's baby that's doing it. Baby that's doing it. What's the evolutionary explanation for that? And that is where we end. We've delivered a baby, and baby's now drinking away, happy as can be, and mom's regaining control of her own body, and she's happier, and we now have a baby. But it is a tremendously complex system. You know, we sing a song in our church,